So today's question is, what should you avoid if you're taking Ramipril, also known as Altace, for hypertension? Well, there's two things in your diet. One is dried fruits like apricots, and the other is bananas. The reason being is that Altace works on your kidney renal system and causes you to retain potassium. So dried fruits and regular bananas are very high potassium sources in your diet. So you risk overdosing on potassium. And if this happens, it can cause cardiac arrhythmias because it affects the electrical conduction to the heart muscle. Now, if you're on a low dose of Ramipril, the risk is a lot less because the degree of retention is also going to be less than if you're on a high dose of Ramipril. So I do have some patients on Ramipril and other ACE inhibitors that take a banana a day with impunity and have been doing so for years with no problem. But if you're on higher doses of Ramipril, you should be cautious, especially when doing combinations in your diet. For example, having a bunch of dried apricots and then later that day having some coconut water and then having a banana too. The potassium can become summated and then cause an arrhythmia. If you're unsure about this, a simple way to test is to ask your prescriber to send you for a potassium blood test, and the morning of it, eat one of your bananas and then see what your potassium level is. That should give you an idea of what your peak potassium level is after ingestion. If it's still within normal, you're probably okay. The second dietary thing to avoid if you're on Ramipril, aka Altace, is salt substitutes. So no salt, low salt. Very often those salt alternatives use potassium chloride instead of sodium chloride as a substitute so that they taste salty, but it's a different kind of salty taste. Potassium chloride is a similar molecule that also tastes kind of salty, but doesn't tend to cause fluid retention, which is what causes blood pressure to rise. So that's why we'll often tell you eat a low salt diet if you have hypertension. The problem with substituting no salt and low salt, if it's the potassium chloride version, is that if you're taking Ramipril, well then there's a secondary effect, which is causing arrhythmias by raising your potassium too high. So in general, if you have hypertension, it is good advice to lower your sodium content in your diet. Thank you for watching. You're welcome.